This was my first in-person doctor interview for my series Prescribe Plants. It was really fun. It was a learning experience for me, both from the standpoint of plant-based nutrition, but also from the standpoint of amateur filmmaking and videography. So, it's not perfect. I'm going to improve on a lot of things moving forward, but I know you'll get something out of it, and I hope you'll enjoy it. Thanks so much for watching. Dr. Thomas Campbell, MD, is the son of famous Cornell nutrition researcher T. Colin Campbell, PhD. He's also the co-author of the China study as well as principal author of the Campbell Plan. He is the medical director of the T. Colin Campbell Center for Nutrition Studies and co-founder and clinical director of the University of Rochester Program for Nutrition in Medicine. Thank you for speaking with me.
Sure, thanks for having me.
I'm a patient. Dr. Campbell, can you summarize a whole foods plant-based lifestyle to someone who has never heard of it and explain why they should care?
Well, it's a challenge in a brief period of time. I mean, this is one of the great challenges of practicing medicine and trying to help behavior change. But basically, the way I describe it to a patient sitting in front of me is I say, we've learned a lot of research about the health benefits of diet and lifestyle and adopting the healthiest diet you can to actually not only prevent disease, but you can reverse a great number of common conditions using optimal nutrition. What is that optimal nutrition? It is a plant-based diet. And what I mean by that is minimizing, even avoiding, cutting out animal foods, meat, dairy, eggs, as well as all processed foods. And when I say processed foods, I mean the fragments of plants that we consume, just, fragments, oils, sugars, white flours, namely. So minimize, avoid oils, white sugars, white flours and sugars. Minimize or avoid animal foods. You're left with whole plant foods, and you can prevent and reverse a great number of conditions that way.
And I heard you speak about reversing certain diseases, chronic diseases. Can you name for us, in your own practice, in your own experience, which chronic diseases have you seen reversed with this lifestyle?
Well, I think the most easy sort of ones to highlight and the ones most readily reversed are the metabolic conditions, and that includes risk factors for heart disease and metabolic dysfunction on its own. So that's obesity, diabetes, pre-diabetes, high blood pressure, high cholesterol, and of course, heart disease itself. Those are what I consider to be sort of metabolic-related diseases, and those are ones that are reversed really, quite dramatically, oftentimes, and quite rapidly, simply by a proper diet and lifestyle.
What piece of evidence or information would you give the most hardcore opponent of a plant-based lifestyle or plant-based medicine?
Well, I think that the thing that people have gotten so excited about in plant-based nutrition, that the cornerstone at this point has been the research on heart disease. There's no other diet and lifestyle that's been shown to reverse advanced heart disease. And you can look at Dean Ornish's work, a randomized controlled trial published in the best journals, carried out very robust, very carefully, high quality, and show that without medication, and this was done before statins, but some were on aspirin, but without medication, cholesterol-lowering medication, people were reversing advanced heart disease with diet and lifestyle alone.
And you don't see that on any other diet or lifestyle?
I have never seen that on the paleo diet. I've never actually seen that on a Mediterranean diet. I've never seen that on any other diet. So this is really the only, and show me, and so you just ask a question, show me another way to have that effect, and we'll have a conversation.
Sure.
But there's nothing else. There's really nothing else. So it's becomes very compelling.
I'm going to draw on the next several questions from your book, The Campbell Plan. You bring up the paleo diet. Why isn't it appropriate to draw parallels between the diet of our ancient caveman or Paleolithic man and the foods that we should be eating today?
Well, what are the foods of our ancient, the Paleolithic man? We can just start with that. What did they eat? That is more complicated and less certain, I think, than many people realize. I mean, people think that they can watch some movie about cave people or something, and they have some sense that they were hunting, woolly mammoths, and they were eating the meat, and like they were carnivores essentially. And there's certainly a lot of evidence that survived that early humans did eat meat, of course, hunting tools and so forth. But what we don't know is how much plants exactly they were eating, how much of their diet was plants. And there's some evidence that I think that probably a larger portion of their diet than we realize may have been plants. I mean, plants are pretty easily harvested in many parts of the world that have a good climate, that are available year-round. And we can now look at some of the recent research looking at dental analysis, and you can see starch granules that have been preserved in the dental enamel. And these starch granules actually prove that these early humans, as far back as 100,000 years, farther back, were consuming starch. Were consuming starch. And you can look at the analysis of some of the enzyme systems in our body, amylase, for example, and that's related to digestion of starch. When did we get the ability to digest starch? And you can form a pretty compelling argument that we've been consuming plants for a long time. It's been a bigger part of our diet than we'd like to think. And, if you go back millions of years, of course, and assuming you believe in evolution, we evolved from very likely from species that were eating almost exclusively a diet based on plants. So there's all sorts of uncertainty there. And then you apply a paleo diet to modern America, and what do most people do? They cut out all starchy foods, they cut out beans, they cut out grains, they cut out dairy, and they're left with what? They're left with meat. Okay, and I don't think that's what our paleo ancestors were likely eating. It's just these engorging themselves on meat 3 times a day. And you look at the health benefits of that and health risks of that, and I think it's quite a dangerous way to go.
In your book, I found it interesting that we think of the food pyramid, the USDA food pyramid, and you sort of boil it down even further into 3 food groups. Can you sort of explain that and present that to us? Yeah,
we have this weird idea and weird pattern in nutrition of, I shouldn't say we, but the status quo in nutrition has been really to discuss nutrition in terms of nutrients and isolated chemicals and so forth and antioxidants. I like to keep things way simpler. I like to think about whole foods and groups of foods because that's easy to understand. And so I have 3 food groups. One is whole, unrefined plant foods. Those are things you'd find in the supermarket, in the grocery store, farmer's market, fruits, things you'd find in the tree, vegetables, root vegetables, all these things. The second food group is animal foods. That's very easy to understand as well. Anything from or of an animal, meat, dairy, and eggs. The third group, and this is a very, very important one, is processed plant foods or plant fragments. So fragments of what nature provided. The 3 biggest offenders in that group are oils, sugars, and white flours. And if you look at most Americans' diets, we have a lot of focus on vegetarian, vegan, eating a lot of meat. It's always sort of plant versus animal kind of discussion. But as I've looked at so many people's food diaries and I have so many patients, I think the processed plant group is really just a massive problem. And people are eating a lot of processed foods. And that's a big part of this. So it's a plant-based diet, but as we always say, it's not just plant-based, it's whole food plant-based.
I like that. Cholesterol. There's arguments from both sides, as you know. Some say it doesn't have anything to do with heart disease or atherosclerosis or chronic diseases at all. And then there's obviously the whole foods plant-based side, where they say, of course it does. Can you explain the body's need for cholesterol and the role it should play in our diet?
Sure. So there's 2 things to keep them separated. One is dietary cholesterol, like cholesterol you eat in the food that's only present in animal foods, animal tissue. The second is serum cholesterol. So the cholesterol that you get that's measured when you go to the lab and you give blood. That's this cholesterol floating around in your blood. And those are two different conversations. I would say that serum cholesterol, your level of cholesterol that's measured when you go to the lab, particularly LDL cholesterol, sort of the unhealthy cholesterol, that is clearly, and that's not just a plant-based argument. This is all of heart disease establishment argument that says LDL cholesterol matters. And it's a risk factor. High LDL cholesterol is a risk factor for atherosclerosis, for heart disease and related conditions. And, you can get into the weeds about, is it a small LDL, fluffy LDL? But the fact is that fluffy, small, they're both dangerous. High LDL is a bad thing for these things. Now, in terms of dietary cholesterol, dietary cholesterol is only present in animal foods. And so we have some research and observational research that shows that, the more cholesterol in your diet, the more animal food, the higher the risk of some of these conditions like heart disease, heart attacks, premature heart disease, this type of thing. But if you look at some of the mechanistic stuff, the really tightly controlled metabolic studies, you can feed people cholesterol in their diet. And it's true. The cholesterol in your diet probably is not the main factor that affects the cholesterol in your blood. It's more complicated than that. It's not like you just eat cholesterol and it shows up in your blood. You can't just eat brain and think better the next day, okay? Your body's digestion is more complicated than that. And one of the things that raises cholesterol that people don't really know about is animal protein. And we have a lot of evidence. This is published in the best journals a long time. Animal protein will raise your cholesterol levels. Saturated fat does, which has gotten a lot of press. Saturated fat in some of these controlled experiments do. But in any case, dietary cholesterol as an indication of an animal-based diet is not a good thing. I don't think, based on a lot of other evidence and conversations, I don't think we should have an animal-based diet. But serum cholesterol, but in terms of the nuts and bolts, is dietary cholesterol really like the bad actor as an isolated nutrient? It's probably actually other things that are more harmful. And then as far as serum cholesterol, serum cholesterol matters. It's not the end all be all. We all have a different genetic baseline. Like somebody could be at their optimum baseline and have a total cholesterol of 200, and that's just where their body is. And they could do everything perfectly, and that's where it's going to land, 200 cholesterol. Somebody else might have a cholesterol of 160 and be doing all the wrong things. They're doing all the wrong things. Their cholesterol is 160. And when you just measure those two things, you're going to say, well, the person with 160 is better. But when the person doing all the wrong things starts eating a healthy diet and starts doing other things in a healthy way, their 160 cholesterol might go down to 110. Okay, so at a point at that, we don't really know. It gets complicated in terms of individual risk. But clearly, as a population, higher cholesterol, higher risk.
Healthy oils and the Mediterranean diet. You spoke of this in your presentation. Is the Mediterranean diet something that we should focus on or put some eggs in that basket, and kind of talk about as well as healthy oils, the extra virgin olive oils, because those are encouraged on the Mediterranean diet. Health benefits to that and sort of controversy with that.
Sure. So two broad arguments that I very generally talk about with regard to oil. One is that, remember, oil is a food fragment. Okay, people think of sugar as sort of the ultimate processed food. I would put oil right next to sugar in terms of the ultimate food fragment. Okay, how many olives does it take to make a tablespoon of olive oil? Depending on the website and the size of the olive and the olive manufacturer you look at, it's anywhere from 15 to 40 olives in a tablespoon of olive oil. So you take all those olives, you mash them, You can do your special cold press, sort of all natural. But still, what do you got? You got a tablespoon of olive oil. You're taking all this fiber. You're taking all this protein, all this iron, all this calcium. You're throwing it out. You're manufacturing rabbit food or something with the byproduct, and you're left with 100% pure fat. Okay, with nutrient deficient pure fat. Okay, so that's number one. Realize that this is not a natural thing that people consume and should be consuming in high volumes. Number two, a lot of enthusiasm about olive oil and canola oil and some of the Mediterranean oils is because they're part of the Mediterranean diet. The Mediterranean diet has been shown to have beneficial effects on everything from heart disease to stroke to certain cancers. And the Mediterranean diet is good. There's no doubt about it. Compare it to the Western diet, the Mediterranean diet wins out. And it's now. So the Mediterranean diet's good, and the message we get out of that is, off as much as anything, is oil. It's all because of the oil, and sometimes you hear red wine. And that's because people love to hear good things about their bad habits. I mean, if you can talk about a study result and say that olive oil is going to save you, people are going to love it. People are going to love it. You're going to get a lot of eyeballs and so forth. But if you compare, let's say the Mediterranean diet is also a plant-based diet. It's also high in fruits, vegetables, whole grains, lower in red meats, lower in liquid dairy and cow's milk, and higher in fish. So if you compare the Mediterranean diet with areas of the world that have traditionally had very, very low heart disease rates, like say rural China in 1975. There was counties with hundreds of thousands of people with not a single documented case of premature heart disease death before age 65. Hundreds of, that's mind-boggling. Yeah. It's crazy. And there are other cultures, traditional cultures historically, that have been known to have almost no heart disease, documented to have no heart disease, and they were plant-based diets. If you were standing in that rural county in China, and you were looking at the Mediterranean diet, you'd say, why the heck are they having so much heart disease in France and Italy? And I would submit to you that it may be because they are adding so much oils. Their diet is healthier, likely in spite of the oil, not because of the oil, but it's an issue of messaging. And there's a lot of details to go back and forth, and reasons why I think I can support that position more robustly than what I've just done. But that's sort of the general gist.
Maybe we'll save that for another interview in the future.
A boring interview.
You speak often of vitamin B12 in your book. We need so little of it, and our bodies can also, the way I understand it, can also store quite a bit of it. Because of this, does the quality, quantity, and route of ingestion really matter for B12 for those who are on a plant-based or vegan diet?
Yeah, people will get kind of wrapped up in terms of what's the best way to take it, what form, this type of thing. And honestly, it probably doesn't really matter that much. I mean, I think if you're on a plant-based diet, if you're really minimizing or avoiding animal foods, first of all, you should be taking a B12. And I don't really care that much about the form, as long as you're taking something regularly. And the starting suggestion I have for people is 100 micrograms daily or 1,000 micrograms a few times a week, and then get your level checked and see kind of where that lands you after a few months, and go from there, adjust as needed.
That sounds reasonable.
Yeah.
Of the benefits of this lifestyle, this is sort of an opinion. I feel it's something people find hardest to believe is that eating this way may prevent and reverse some kinds of cancers. Can you describe the main types of cancers that have been shown to be most affected by this diet and lifestyle? So
cancer is interesting in that cancer is a disease of affluence, and many people don't really know that. Certain types of cancers, I should say, certain types of cancers are a disease of affluence. There are some cancers that traditionally have actually been quite high in developing countries because they're related to viral infections. So liver cancer, for example, is related to hepatitis. And there are developing countries where sanitation and so forth means that vast numbers of people have hepatitis. So some of these cancers are not food-related, they're more related to viruses. But there's a certain cluster of cancers that clearly is Western disease of affluence, and those are mostly related to hormones as much as anything. breast cancer, the biggies, breast cancer, prostate cancer, colorectal cancer. Realize that those three cancers, which are huge, scourges of cancer incidence in Western cultures, those three cancers have traditionally in many parts of the world been way less prevalent. So this is not a natural state of our human body to have such a high rate of breast cancer, prostate cancer, and colon cancer. So what's that related to? It turns out that through some of the earlier research, there's a lot of justification for the idea that it's probably related to diet and lifestyle. Exercise matters. We know that from a lot of research, but also more plant-based diets, more antioxidants, more fiber, more fruits and vegetables, and then less of the animal foods and less of the processed foods. And there's a lot of evidence, particularly in experimental animals, that show the mechanisms for how these things work, the mechanisms for how a plant-based diet, for example, affects enzyme systems and DNA repair and so forth, et cetera, on and on. So there's a lot of reasons why we've observed that these plant-based diets are linked to lower rates of these cancers in some earlier research. We also have mechanisms to suggest why this is true. I will say, for the skeptical person sitting in front of me, that it is true that we need more research. The only human clinical trial that I'm aware of currently, like a randomized clinical trial published in good journal, is Dean Ornish's work with early-stage prostate cancer. And he showed that men with early-stage prostate cancer on a whole food plant-based diet with group support, meditation, and exercise can actually halt or reverse their early-stage prostate cancer. That's a big deal. I mean, that one finding is a really big deal. But beyond that, we definitely need more research. And actually, that's one of the most exciting things about what we're doing here at the University of Rochester is we're starting some research, clinical human research on dietary intervention in advanced cancer.
Neat. Very neat. We know that this country's health problem, there isn't just, if there was one simple fix-all, we'd say, okay, let's address that, and boom, we're done. It's multifaceted. I'm sorry, I lost my place here. If you had a magic genie, what areas would you address to make the most impact on this nation's health?
So I think that the number one problem for our health that we face is nutrition. It's our food environment. We have such a horrible diet, and the standard American diet is so heavily processed with processed plant foods and meat and cheese, and that's what a lot of people are eating day in, day out, and they're putting trash in their body and garbage in. You're going to get garbage out, and so we are unhealthy to an enormous extent because of the food we are eating. And if I were going to change anything from a public health point of view, it'd be like the smoking model. You would institute all sorts of interventions where unhealthy eating becomes difficult, expensive, and abnormal. It's socially abnormal, and you do that. You do that by changing the availability of food. The prices of food, the subsidies that go into food production. We wouldn't subsidize processed or animal foods anymore. I mean, if I had a wish list, we'd just change all this overnight, and like fruits and vegetables would be everywhere. They'd be practically free, and meat would be $10 a burger.
And you can get fruits and vegetables at the convenience store, let's say, at the 7-Eleven.
Right, and that public health intervention, I think, would have the biggest impact on our nation's health more than anything else. I mean, let me step back a little bit and take off my nutrition food enthusiast hat and say probably, if you really wanted to had a magic genie, the thing that I would do is I would get rid of adverse childhood experiences. If you look at much of the badness in this world, people's maladaptive behavior, it's related to early adverse childhood experiences, and that's a big problem. Sure.
I thought it was interesting. If you can just briefly, you said something interesting in your talk today about how people get the most antioxidants in their diet from coffee.
Yeah, there's one study, I think if I remember correctly, at Scandinavia, and they looked at where they were getting their antioxidants in their diet, and some absurd percentage of antioxidants in their diet came from one thing, and that's coffee. And coffee is bean juice, right? So it does have a lot of really interesting antioxidants in it, and a lot of antioxidants. But that's a testament to the fact that we don't really eat many fruits and vegetables in the Western diet, but we do drink a lot of coffee.
If you had this is again kind of another hypothetical magic genie. We're going to go with, if you had a megaphone that could selectively reach everyone who's failed at dieting, losing weight, becoming healthier, what would you tell them?
I would say there's an easier way. And you can't tell in 3 seconds, but basically our standard dieting model has failed. And the model is eat less, exercise more. That is, variations of that theme is what most adults who have struggled with their weight, which is most Americans, who have struggled with their weight, have been on that path of eat less, exercise more, and they've done different programs, Weight Watchers, whatever. They've done these things over and over and over, and it works in the short term, and then they gain it back, and it's a cyclical problem. And the problem with eat less, exercise more is that it's very appealing in the beginning, and you can even see in some of the popular program commercials, you can eat whatever you want. You can eat whatever you want. You go eat some cheesecake. You just need to eat less of it.
Sure.
You just less of it, right? And as long as you then go to the gym and exercise more and stuff. And so intuitively, that sort of seems very appealing, like, oh, it's easy. And everybody can do that for a few weeks. The problem is the hard work of eating less and exercising more. It never gets easy in that model. It never gets easier. I mean, for the rest of your life, you're supposed to be hungry and eat less? No way, forget it. Everybody falls off that plane. Right. Everybody. And so the hard work never goes away. I like to suggest a different model, and that is choose different food, change your habits and your tastes, eat as much as you want, satisfy your hunger, and you will lose weight without hunger, without starving yourself. And in that model, unfortunately, the hard work is really hard up front.
Right.
Because people are changing tastes, changing habits. That's hard work. Once they do that, though, then the hard work melts away. It's smooth sailing forever. And you can continue to eat a healthy diet. There's no hunger. There's no calorie counting. There's no carb counting. It's about making healthier food choices.
That's very powerful. I did have one sort of fan submission. I posted, hey, I'm going to be interviewing Dr. Campbell on my social media. Someone asked about dysbiosis, or the imbalanced gut bacteria. If you ever recommend to your patients to be eating prebiotic foods, are you aware of any problems of dysbiosis caused by eating those prebiotic foods? I'm
not aware of any problems with dysbiosis or microbiome imbalances or something by eating healthy prebiotic foods. Some prebiotics are dairy based. I mean, people get yogurt and stuff, and I suggest you probably could get something better than yogurt, but but there are some other things, and some of the things that our bacteria thrive on is things like types of fiber, resistant starch. These are in all of the plant foods, unrefined plant foods that we eat. And so in studies that I've seen, having a very low fat, and people usually aren't aware that high-fat diets actually have been linked with dysbiosis or metabolic microbiome problems. But a low fat, not a no fat, but you stay away from added fats. A low fat, high fiber, plant-based diet is oftentimes linked to what seems to be a more beneficial microbiome. And we're still learning a lot about the microbiome, so it's hard to say exactly what each change means at this point. But it seems that a low-fat, high-fiber, plant-based diet is best for the bacteria. It's going to keep them in better balance, and they're going to have better health effects for you.
Great.
All right.
Dr. Campbell, thank you very much for your time.
Sure, no problem.
Thank you.
My pleasure.